I'm 𝘝𝘦𝘯𝘦𝘧𝘪𝘵𝘴. I'm a Royal College certified vascular surgeon that is working here at 𝘉𝘠𝘦𝘯𝘦𝘧𝘪𝘵𝑚𝑒D to treat your venous problems from small spider veins to big varicose veins. So varicose veins are a development of a disease of your veins that comes from refluxing of the blood through your saphenous veins. These eventually would dilate and that will create varicose veins, as you can see in your legs. Chemical ablation of the saphenous veins is a method of treating varicose veins that includes blocking the vein from the inside with a small chemical glue to close it shut and prevent refluxing of the blood, and then eventually will control your varicose veins. So that will be a personalized decision that you should discuss with your physician, but in general, as a general rule, is a patient that has varicose veins demonstrated by ultrasound and that they have clinical symptoms or cosmetic concerns. So we will achieve closure of the vein via accessing the vein and then slowly deploying this chemical glue inside the vein throughout the length of the vein and eventually achieving complete closure of the vein. Well, as any procedures, there are some side effects that are very rare. The most common symptoms will be a little bit of tenderness after the procedure. There is also a very small chances of allergy to the glue, which is very unusual, and very rare instances we can have deep venous thrombosis or clotting of the blood vessels in the legs. In general, no, this is a permanent solution to close the veins. So in general, you don't have to repeat those. I will say the downtime will be the day of the procedure and maybe 1 or 2 more days where you're gonna have a little bit of tenderness on top of your vein, but after that, most of the people will be able to return to normal activities. So there are other alternatives, which is the surgical removal of the saphenous vein, and that includes general anesthesia and a procedure in hospital. So there are inherent risks for the general anesthesia and any patient that is hospitalized. In general, no, unless we have to do some other treatments as sclerotherapy to control some of the branches from the saphenous vein, then you have to wear compression stockings, but that will be a treatment that your physician will be able to identify. So the benefits, there are 2 here. The one is a cosmetic benefit, so certainly your veins will improve to the looks. Also there's a functional improvement, so you will feel less heaviness, less tiredness, and you have a decreased chances of developing ulceration or bleeding from these veins. Once you perform the ablation of the vein, what happens is the body will create an inflammation around and inside the vein, and over time this will shrink and just be a small fibrotic tissue inside you.